Honourable Speaker, healthcare remains one of the most important issues raised by the constituents in Ladysmith-Oceanside. Whether speaking with seniors or young families or frontline workers, I consistently hear the same message: access matters. People want timely care, they want continuity, they want to know that professionals are supported and that facilities are equipped to meet the demand. And Budget 2026 continues meaningful investments in strengthening the healthcare workforce, expanding primary care access, and supporting facilities across the riding of Ladysmith-Oceanside. Improved access to family healthcare practitioners strengthens preventative care and reduces strain on emergency services. And supporting healthcare workers improves retention and morale. And Budget 2026 invests $2.8 billion in new funding for the healthcare system over 3 years, including $2.3 billion to increase healthcare system capacity and support a growing need for service, including supporting hiring more doctors, nurses, healthcare practitioners, and the planning and development and operation of new and expanded hospitals and healthcare facilities across the province. For Ladysmith-Oceanside, this is represented and reflected in the generational investments in the Central Island region in healthcare infrastructure. This includes the recently completed high-acuity wing at the Nanaimo Regional General Hospital. Construction has started on the $300 million Nanaimo Cancer Centre to ensure that the residents of Ladysmith-Oceanside can receive the care they need, when they need it, where they need it. The new long-term care facility in Lancefield will see almost 300 new beds, including a 20-bed hospice unit and 26-bed specialized population unit. Through careful work with Island Health for a thoughtful redesign to bring costs down and in line with this current moment, and I will say strong advocacy from the Central Island MLAs, this project has cleared planning hurdles and is scheduled to open its doors in 2029. And last week, we were pleased to announce the beginning of a concept plan for the replacement of the Nanaimo Regional General Hospital Tower. These are generational investments, and Budget 2026 will also include $121 million for intensive mental health and addictions treatment. For Ladysmith-Oceanside, this means the opening of an addiction treatment facility that will be accepting new patients in Parksville in the fall of 2026. The centre will have a road to recovery model, which will include 19 overnight beds, as well as plans to provide counselling services to those in need of post-treatment and transition supports. Continued infrastructure and service investment ensures regional accessibility for people of the Central Island region. To ensure that British Columbians have sustained access to family healthcare practitioners, this government is planning for the future by building Canada's first new medical school in 60 years, training the next generation of doctors. And this government is looking ahead, unlike previous governments who rejected a plan to build this medical school. They rejected it. These measures contribute to tangible outcomes: shorter waits, better continuity, and stronger patient confidence. The riding of Ladysmith-Oceanside, this has translated into more than 10 new family healthcare practitioners in the last year alone. We heard last week 4,200 people a week across BC are being attached to family healthcare practitioners. And just recently, the Our Care Survey, a national project on primary care, said that BC is the most improved province with healthcare access to primary healthcare. We currently have an attachment rate of 83%, which is up 12% in 4 years. I'm receiving emails weekly from the people of Ladysmith-Oceanside who have been attached to a new family practitioner, and we know that there are more coming in the next year. And that's what it looks like when you prioritize the services that people need. Investment in healthcare is a cornerstone of this budget because we know that people deserve access to the care they need when they need it, and we have continued to prioritize that. And it affirms that the public healthcare system will remain a pillar of equity in access to health.